Hi, I'm Stephanie and I'm from the ADHD Advocate. Now, this month we are celebrating ADHD Awareness Month and we are at the end of week 2, where we've been looking at friends and family specifically. Now, today we're doing a little Q&A with Ruth Dines, who is a therapist and also a tutor. So I will hand it over to you, Ruth, to introduce yourself. Thank you for coming.
Hi, Stephanie. Good to be here. Yes, I'm a therapist in private practice where I have a number of clients presently and in the past who presented with ADHD. And I'm also a tutor at college where we have students who have ADHD. So I've been working for a while now in this area.
Which is great for us because we're going to ask you a few questions. Firstly, what kind of communication challenges do you find with the people with ADHD that you see?
Well, when they come to me, they talk about the difficulties sometimes they have in relationships, and that can be because of some of the symptoms of ADHD, which can be interrupting, forgetfulness, not paying attention, procrastinating, so not doing things that they've promised others. And that can cause irritability, it can cause them to feel overwhelmed, and then they can feel anxious. And all of these things affect their relationships, both within a work environment and personally with friends and family.
Yeah, it's difficult, isn't it? Because I see that there's a lot of misunderstandings, again, because some ADHDs have trouble being able to kind of communicate with enough specificity as well to not have to rule out any misunderstandings. It's difficult.
Yeah, you see, leading on from that, I mean, I like to do a little psychoeducation with my clients. I'm not a clinical psychologist, I can't diagnose, but obviously I can work with people who've had a diagnosis or maybe think they have it. But, you know, ADHD affects the prefrontal cortex. That's the front part of the brain here, which is responsible for rational thinking, logic, planning, working memory. So, of course, if someone does have ADHD, it's not their fault if they can't remember as well as the other person, or if they actually haven't got an ability to manage, regulate emotions in the same way. So, or aren't organized, so they end up always being late or not delivering what they do, especially students. So we have to understand that this does affect the front part of the brain, and therefore we have to work with clients to help them first of all understand it, make them realize it's not their fault in terms of it's an explanation. But we can use strategies and interventions to help them overcome these things, and also to explain to others why maybe they present the way they do and why they are in relationships in a way they are.
It's so important, isn't it? Just to, again, going back to the lens and the importance of being able to look through the lens yourself, but then to help others look through that lens too.
Exactly, and that's something we call mentalization, which is, you know, how do people experience me? How do I come across? Because when we understand how people experience us, we can then make a decision about how we want to present to others and what we can do to explain and communicate about being this way, because it's different. It's a level of neurodiversity that is different to others and it's unique. But it also brings with it an enormous number of strengths, which I also want to let my clients know. You know, people with ADHD can be incredibly creative and passionate and spontaneous and have real sensitivity, so they can see the big picture. Some of my ADHD clients see things in a way I don't, and that's so wonderful to see the world through a different lens. So it's not odd, it's different, but it brings with it a lot of positives. But clients have to get to that point once they've had a diagnosis, because at first it can be a real shock. It can be a real relief, but it can be a shock. And it's how we work together to go through that process of understanding.
Yeah, it's so important, isn't it? Doing that work first, making sure that lens is clear, I guess. There's no point in trying to give those strategies if they're not kind of looking at themselves clearly, understanding that diagnosis and how it affects them, and be able to differentiate between what they may have been talking about as character flaws as opposed to ADHD traits. So I love.
Exactly. Yeah, that's a really good way to put it, because you know what? A lot of my clients will say to me when they've had a diagnosis, things make sense now. Now I understand why I had problems at school, or maybe problems with my parents. It all makes sense. And it becomes like a jigsaw puzzle for me, that we start to put the pieces together of understanding, acceptance, and maybe there's loss for what happened in childhood that they didn't have or wanted, that we can now look at through a different lens. We can reframe sometimes the experience.
Yeah, the reframing, actually, that's what I want to ask you as well, in terms of Oh, and some ADHDs very much hear their thoughts, and they're not good, a lot of them, right? But there are other ADHDs that aren't aware of what they're actually thinking, but obviously what they're thinking, the thoughts that they have, are going to affect how they get, well, obviously their moods, but also communication, their relationships. So what do you do? Well, how does CBT help with that?
Yeah, CBT is a really good one, actually, because, again, it's a process. And I wouldn't necessarily do CBT at the beginning, because I think clients, especially newly diagnosed, have to work through what's going on for them, their emotions, their thoughts. But once we've got to a point where they're ready to start looking at how things could be different, CBT is great. And just to, put it into a few words, if we change the way we look at things, the things we look at change. And I think that's such a fundamental part of CBT. And so what we want to do is give them a different lens now to see the world, because obviously from their experience of having ADHD and maybe not being understood, heard, validated, supported, they're going to have maybe self-esteem issues, a lack of confidence, anxiety, feeling that people don't understand them. And what we've got to do is look at the way they think, look at the way they feel about themselves. And we start to use things like cognitive distortions. Are they catastrophizing? Do they see things in black and white? Do they compare themselves unfavorably? There's all these what we call cognitive distortions that we rate people against. They rate themselves against them. And the ones they score highly on are the ones we want to really work with. So people who've had ADHD may see everyone else as more okay than them, or them as more clever. Yeah, and they compare. They can also see things very black and white. If it's not like this, then it's like that. There's no grey. And by the way, that's with people who don't have ADHD. Let's just normalize this. A lot of the symptoms of ADHD are what people in the world present with anyway, without that diagnosis. So we work to make them see the world in a different way, reframe, in a sense, what's happened, that this wasn't their fault. They weren't responsible. They're not lazy. They're not odd. They're presenting with a level of neurodiversity that makes them different and unique. So we start to build the self-esteem, we start to learn to manage the anxiety, we start to work on those areas which can really impact relationships and personal health and enjoyment of life. And what it is, it's about acceptance. It's accepting the differences, learning to accept them, to acknowledge them, and then look at the strengths, the gifts and the talents that ADHD does give you.
Yeah, no, it's such important work. And that's what we're really trying to emphasize this month is, really the importance of that ADHD lens and having that self-compassion, that acceptance piece that you're talking about, and also naming it to tame it in terms of the thoughts, particularly that you're having, calling yourself out in a compassionate way, of course, but also identifying the feelings. Because again, a lot of ADHDers don't really stop to work out how they're feeling. They just...
And that's what we do. That's a great point, Stephanie. That's what we do in CBT, is often the thought triggers the feeling, which triggers the behavior. So if you think I'm not good enough, you feel sad, low, and then your behavior will represent that. You may go to bed, you may say, I can't finish this project, I don't want to go to this meeting. So what we do in CBT is we start with the distorted thinking, and then we work down from that way to make people understand how thinking that negative way will make them feel negative. So it's a whole loop here of how we're getting them to see things differently. And, it's just really important in a way that we work with people's anxiety to help them with their self-esteem. Yeah, reinforcing the positives in that sense.
Yeah, and I guess that is the precursor, isn't it, to communicating to others as well what's going on for them, because often, even when we know what to do, there's a saying that ADHDers know what to do, we don't do what we know. And I guess very much when it comes to the emotional dysregulation, even when you know about these tools and what we should do in the moment, it can be very difficult to access.
Well, yeah, because the problem is, and this happens with people who don't have ADHD as well, of course, is that there's a lack of emotional regulation. But in the moment when we have anxiety, we don't think straight. It's a normal response to fear. So when we have something that feels threatening or upsetting, whether that's for presenting something to a group or having your boss ask you for something or a difficult relationship with a partner, we go into this fight, flight or freeze when we're upset. And that's I want to say to you, that's a very normal response. So we go into fight, which is we avoid, but we fight with someone, or we go into freeze, or we go into flee, which is I'm going to get out of here. And that is a normal response. What we try and do in CBT is to get people to stop and to think about their thinking, because people don't often realize they've had a thought, they just have a feeling.
Oh yeah.
The thought is so fleeting that they just think, oh, I feel bad, I'm anxious, but actually something's triggered that. And when we start to think about our thinking, we can see what the triggers are to help us, alongside doing a lot of somatic body work, because that's really important, Stephanie, that people don't realize. We can't just use the head here. We've got to calm the limbic system and the body, because that's what reacts immediately when we're fearful. It's like when you see a snake, you don't necessarily see it, but you feel it and your body reacts. That's your limbic system going into overdrive, saying there's danger. And that's what we do even on the road, if someone cuts us up or someone's rude to us in a shop. So we have to learn to calm the limbic system alongside looking at the thinking patterns. It's combined. You can't do one without the other.
Yeah, that is such an important point. And actually in coaching, a lot of the time, yeah, we encourage people to get out of their heads and into their body. And is that,
but lots of people will avoid that. You see, most people do what they can to avoid feeling bad. It's a natural response. Why wouldn't you?
Yeah.
But unless you accept and acknowledge difficult feelings, feeling discomforted, unless you learn to do that, that will always take over.
Yes,
it's a bit of mindfulness. That's the mindfulness bit. Acceptance and commitment therapy is accepting your anxious thoughts and working with them, being curious. What's this thought telling me? What's this discomfort? That way we think about it to try and understand it. We don't just feel it and then try and distract.
Yeah, this has been so helpful, Ruth. No, thank you so much for coming and speaking to us about today. And we'll put Ruth's details as well in the comment section. So if you'd like to know more or contact Ruth, you'll be able to do so. But Ruth, thanks again. It's been really, really helpful.
Thank you, Stephanie. It's been great. Okay, take care.